do know that family planning is one of the best ways to improve or reduce maternal mortality and morbidity. When you do family planning and spacing, the woman is able to recover for the next pregnancy. Not only that, the little child born is also strong enough to be taken care of before you get another one. So I think this is good. And the best way to reduce maternal mortality and morbidity is family planning.
TCI came to the state about 3 years ago. We provided an office space for them, so they are embedded within the agency with our staff. So there's a lot of learning, coaching and mentoring that has taken place, a transfer of knowledge between TCI and our staff, and that informed a lot of ownership. And now that we are transiting into graduation phase, I'm sure most of those learnings will be sustained.
TCI, when they came in, they discovered that they can reach our people through the media stations, through using our native language, that is the Hausa in specific.
TCI trained journalists in Gombe State. Over 20 journalists were trained on what family planning is, the terms to use. So that has helped us relate to the people well. There is now collaboration between journalists, NGOs and healthcare providers. It also helped us, gave us opportunity to talk with the commissioner. We can assess the commissioner of health, the ES, Primary Health Care and Development Agency, and it gives us information. TCI has helped us in that.
Significant changes from TCI, they are concerns from their inception in the state. They included something that was not part of what we're doing in the state, which is the traditional and the religious leaders. We now have a very robust interfaith forum, and they are doing very well in the state.
During our gatherings, the learned people disseminate the information there before the Friday prayer. Then the imam or the people that used to speak, the learned people that used to speak before the prayers, will disseminate information on this childbirth spacing. Not only on Fridays, other gatherings like naming ceremonies, marriages, this information were also disseminated. This led to the clear understanding and acceptance of childbirth spacing in Gombe State.
We were made to understand there were misconceptions. So in the course of this program, we tried to clear the misconceptions in the minds of the people and to tell them the benefits. So the religious leaders take it very serious, preaching in favor of the childbirth spacing, conducting seminars and workshops to our people, and our people were very, very happy about it, and they took advantage of this. They participated fully, and is yielding positive results.
In the past, we do not even have a budget line for family planning, but now we've seen a budget line being created for family planning, and then improvement in allocation over time, and then improvement in releases.
So when TCI came, they were able to train a number of healthcare providers. So either on the job training, so they were able to train providers from 36 private sectors that we have on tools that we use for family planning, and then the family planning methods. So this has helped in more uptake of services that we have, and then the data that are generated from all the private sectors and then the public facilities were able to be harnessed in one document.
For the quality of data in the state, we have what we do monthly as data validation meetings with all the facility managers. And we have what we do after that in the state level as data quality analysis. All the data being submitted to the DHIS2, we roll it over to see what we have. Then we can be asking questions where necessary. So these are some of the checks that we have to do in terms of data to ensure that the quality of data is being reported in the state.
There are national guidelines for the promotion of family planning commodities, and through the support of TCI, we adopted these guidelines. And after the adoption, we took on the bull by the horn. We started procuring family planning commodities. The state is among some of the few states that use state resources to procure family planning commodities. And this, to some extent, has reduced out-of-stock family planning commodities in our facilities.
TCI has done a lot in capacity build. The continuous supervision that they have been doing, the on-the-job training, they mentor us. If you don't have any confidence on counseling your client, if you are not bold enough to tell your client what family planning is, there will be a problem.
A social mobilizer, not even some social mobilizers like talk to me, I got to know what family planning is. I also went to the facility and I heard of family planning. I was like, okay, this is the real conception about family planning.
She gets back, she relates it to me, we sit down, look over it, think of the advantages over the disadvantages and adapt.
It was after my family planning I was able to further on my education and also that of my children. Like presently now they are in good schools. If I didn't go for family planning, it would have really been a hell to the family. So I think family planning has really helped us.
There are some women going between house to house. When they come into our house, they inform me about the planning, this is the way they will do it, this is the way they do it. So for the first time, I'll advise my husband so that we can plan. We take the advice and I go and do it. So I used to have 3 years interval between my children.
Before we were highly skeptical, but gradually we started to understand the benefit of the family planning. Family planning not stopping the birth entirely, but giving space.
Initially, we don't have the strategy, but with the coming of TCI, they make that, they suggest us, they bring all this strategy, and because of that strategy, we have a lot of, the coverage has been increased beyond your expectation. So there's a significant change in the state as a result of coming TCI Gombe.
The motivating factor was the leadership, both sides, and the partnership yielded this result. The presence of TCI at any time we need them. They were just there every moment with them throughout. There were no break, consistency and proactiveness, then always willing to provide what we wanted, like the supervision, like the monitoring, like the training and retraining. These were key. But I must say, the experience with TCI was superb.